Most patients that are looking for veneers are coming to you with discoloured teeth. We will get patients to fill out a form. It's what we call a patient's concerns form, with various boxes for your concerns. We'd like to identify exactly what it is that you don't like about your teeth at that first consultation. So the patients will come to you with discoloured teeth. There may be some staining from nicotine, red wine, all of the bad things that make your teeth go either brown or yellow. So we'd like to get that all polished off, and then the next stage may involve doing some tooth whitening of, say for example, your bottom teeth before we would proceed to doing any porcelain work. Porcelain is usually the last thing to happen. What happens first is more important, that we're dealing with a set of teeth and gums that are nice and healthy, nice and clean. You want to bond onto enamel which is going to be strong, and you're not going to have a filling that's either leaking or bacteria getting into, so it's all sealed off nicely, and that means it's going to last for a long time. You come in for your consultation and we'll again take x-rays. We would always like to see a full picture of the roots of your teeth before we decide to put any restorations on them. So make sure they're nice and healthy, there's no history of infection there, or there's no risk of infection going forward. The next stage would very often be the whitening or the scale and polish with the hygienist, possibly both. And I would say the third thing to happen would be that we would do the adjustments to your teeth. That's usually quite a long appointment, and we get the ceramist to come out and hopefully identify the right shades, the right translucency or opacity of the porcelain that's needed to mask whatever problems that you have in the underlying enamel or dentine. The final stage is obviously that you would come back and you would get the porcelain fitted. And that can be done, if it's same day veneers, obviously, we would start things usually about 8 o'clock in the morning, and we would finish off with an appointment, hopefully by 5 o'clock, and we can all be going home for 7 o'clock. With any restoration, we would usually say don't eat anything at all for 1 hour and stick to a soft diet for the rest of the day. If the treatment's done on the right side, we'll ask you to chew on the left, and vice versa. But the following day, within 24 hours, you can carry on as normal. And there are certain caveats that we would tell you, as suggested, that there are certain actions that you should be avoiding, trying to look after the porcelain and make sure you don't stress it unnecessarily. Some patients will go home and we'll maybe make a mouth guard for them to wear at night time, so that the teeth won't move. Long term, hopefully in 10, 15, 20 years, the porcelain is going to look just as it is on the day that it's fitted. You get them cleaned regularly, you're protecting them with a retainer at night time if there's a risk of teeth movement, or alternatively if patients grind their teeth, we might fit them with an appliance that will stop them from doing that. To be honest, because nowadays we are practicing techniques which are very much more conservative than we were 24, 25 years ago when I first graduated, I would say that the post-operative symptoms with veneers are very mild 99% of the time. Occasionally patients will report some sensitivity, but that can usually be controlled with a good sensitivity toothpaste. And I would say that no pain after porcelain veneers is the feedback that you very often get. Very often people will come and see you and ask you to do veneers when their teeth aren't straight, and it's not always the right thing to do. It's much easier to make your teeth look good when they're in the rightful position. It's also much more hygienic because you can get floss in there. So there is sometimes an ethical discussion that you have to have with the patient, that although you might think porcelain is the answer, if your teeth are even just a little bit more than slightly crooked, then veneers are probably not the right thing for you.